If you experience any of these signs I'm about to mention, there are possibilities that you may struggle to get pregnant when you're finally ready. Whether you're single or you're not yet ready to start having children, it's important you go get tested and treated before you try to start getting pregnant. That is what we'll be discussing in this video: signs that you may struggle to conceive. If you're seeing this face for the first time, I am Oswago Chidema Michelle, a certified nurse midwife and a nutritionist. And in this channel, we discuss everything about mother, child, and family at large. Mind you, it doesn't necessarily mean that if you're having one of these symptoms I want to mention, then automatically you are going to have infertility issues. First of all, what's infertility? Infertility is when two couples are having sexual intercourse consistently, regularly, and constantly, and within that 12 months of exposure into sexual intercourse, they are not able to conceive. That is when you say that these couples are facing challenges getting pregnant. One of the first signs that could show that you may struggle to get pregnant is abnormal, painful periods. Like whenever your period comes out, it's so painful, so excruciating that it affects your activity of daily living. Like you cannot do without painkillers, you're always with painkillers, you go through a lot of pains whenever your menses comes out. It could be endometriosis, who knows? That is why you need to get checked up and treated, because endometriosis can pose you into struggling to get pregnant. Abnormal, heavy menses. Like whenever your period comes out, within an hour, you've soaked one pad, you've soaked two pads. You need to know why you're having such a heavy flow. Who knows? It could be uterine fibroids or submucosal fibroids. Fibroid is at the wall of the womb, especially where your baby is going to grow. It's going to pose a lot of struggles for you. Irregular or absent periods. Now, some ladies can go 1, 2, 3 months without seeing their periods. Some even see their period just twice in a year. Now, such people, it is practically impossible for them to ovulate, and without ovulation, pregnancy cannot be achieved. In most cases, PCOS, that's polycystic ovarian syndrome, could be an underlying factor for that. You're getting exposed to STIs, that's sexually transmitted infection, all the time. Now you can risk yourself into getting things like gonorrhea or chlamydia. You're exposed to things like pelvic inflammatory disease. Your body starts forming scar tissues around the reproductive area, and this will pose you into what? Difficulty getting pregnant. Hormonal changes or issues. Most often it's difficult to ascertain this unless you do a hormone profile to check the values. But you can get signs like acne, hair on the chest, the chin, which is known as hirsutism, and it's mostly found in people who suffer from PCOS. So you can get that found and get treated. Nipple discharge. Like you're not breastfeeding, you're not pregnant, and you keep noticing discharge of milk coming out from your breast. It could indicate that you're suffering from prolactinemia, that's high level of prolactin, and it can easily be treated. All you need to do is just to go see a doctor. Over-the-counter medication like the bromocriptine or gabapentin can be prescribed for you. If you take it, it will do well to bring down this hormone. With this, we've come to the end of this video. I hope you enjoyed it. So if you like what you watched, endeavor to subscribe to my channel, like my video, and share to others. Remember, together we can make it work.